If you're planning to apply to medical school and you're not sure how to get clinical experiences, these are some of the most common ways that my clients have gotten their clinical experiences. Number one, shadowing. If you have contacts, if you know physicians, you can reach out to them and ask if they'll let you follow them while they're doing their clinical work. Not everybody knows a doctor, and if you don't, try reaching out to your own primary care physicians and seeing if they'll let you follow them or somebody they know. Many people don't have access to that. So number two is volunteering. Sometimes you're directly volunteering in a clinical space where you will get to see doctors doing their work. Maybe you're helping with vitals or intakes or something like that. That's still clinical work, especially if you're interacting directly with patients. It can be very valuable. Other times you're volunteering in a role that you're not actually seeing what the doctors are doing, but as part of those programs, which are often accessible to undergraduate students, they give you a certain number of hours to shadow across a semester. The third way is actually to get a job in the clinical space. For many people, that'll be doing some front desk type work at a private practice. Other people will do some training and become a behavioral health technician, a surgical tech, or a medical assistant. What I want to highlight here is that there's not really a hierarchy of bad to better experiences. In general, if you get some direct patient-facing work where you're directly interacting with patients in whatever limited role, and if you spend some time actually following along with the doctors, for many people that's scribing, for others it's shadowing, you should be okay regardless of what specific thing you did. The last point I want to make is that it is not just about hours. 500 hours is not necessarily better than 100 hours. I myself applied with something like 20 or maybe 40 hours of shadowing, I don't remember. But I'll never forget one of my mock interviews where someone said that they have so many people with hundreds or even thousands of hours of shadowing who have nothing intelligent to say about it. They're not sharing this deep reflection that they had, what inspired them, what they learned. And so all of those hours fall flat. They just feel meaningless because it's unclear what the person learned. So no matter what you do to get your clinical experiences, you want to make sure that you can speak about it in a coherent and meaningful way. The hours are not valuable because of the quantity of them that you collect. They're valuable because of the quality of how they impact you. Final tiny little caveat here. There are some medical schools, the one that comes up with my clients every year is Georgetown, but there are some that have more particular requirements about how many hours they want to see. So always make sure that you're verifying any information you find online with the actual admissions pages of the medical schools that you're applying to.